This is Rural Health Leadership Radio.
Episode 153, a conversation with Greg Ruberg, President and CEO of Lakeview Hospital in Two Harbors, Minnesota.
I think especially in rural healthcare, we have to be open to innovation, and we have to be looking at ways to improve and drive change and bring more value to our patients.
Welcome to the Rural Health Leadership Radio with your host, Dr. Bill Oxier. Each week, Dr. Oxier has a conversation with a different rural health leader to discuss what's working and what's not working in rural health, along with other topics of interest to rural health leaders. Rural Health Leadership Radio's goal is to improve health in rural America by providing a simple, no-cost means to share information and connect rural health leaders from around the country. And now, here's Dr. Oxier with today's guest.
Hi, everybody. I am your host, Dr. Bill Oxier, and welcome to the Rural Health Leadership Radio podcast. Rural Health Leadership Radio is a 501c3 nonprofit, and today's episode is made possible by my company, Bill Oxier Healthcare Executive Coaching, who made a donation to cover production costs. I work with rural health executives to assist them in becoming more effective leaders because leadership makes the difference. And speaking of making a difference, I want to thank today's guest, Greg Ruberg, for taking time out of his busy schedule to have a conversation with us today. Welcome to Rural Health Leadership Radio, Greg.
Thank you. Glad to be here.
Greg is the president and CEO of Lakeview Hospital in Two Harbors, Minnesota. So, Greg, tell us about yourself. Who is Greg Ruberg? What's your story?
Well, thank you. I'm Greg Ruberg. I'm the Vice President of St. Luke's Hospital in Duluth, Minnesota. It's a 267-bed hospital located in northeastern Minnesota. As part of that role, I'm the President and CEO of Lakeview Hospital in Two Harbors, Minnesota, and that's a 25-bed critical access hospital. I also have the opportunity to provide administrative support of North Shore Health up in Grand Marais, and I'm the board chair of Wilderness Health, which is a 10-hospital collaborative in northeastern Minnesota. And I've got the fortunate opportunity to be able to work in urban healthcare, rural healthcare across our region, and have had a lot of experience in rural healthcare over the course of my career, dating back to becoming a physical therapist in 1998.
Oh, wow. Okay. So even though you do work in urban areas, you are a true rural health leader with all those hats that you're wearing, Greg.
Absolutely. The majority of my work is supporting rural healthcare across our region, and really is my passion in healthcare is to be working in rural health and helping to advance rural health wherever that I can. Well,
thank you. So why did you choose healthcare as a career path?
Well, back in high school, I was a basketball player, and I was practicing one day and had a pinched a nerve in my neck and had a pretty significant pain in my neck and down my arm, and went in to see our rural family practice physician, who referred me to physical therapy. And that was something that kind of sparked my interest, both medicine and the rehab field. I really I got to know my therapist well. He treated me effectively and got me back to basketball rather quickly. And I thought, well, that's a career that I could certainly do the rest of my career. So I like the relationship that was built with that therapist and knowing all of the patients and staff. And so I went off to college, became a PT, and eventually ended up as a rehab director right out of college.
Oh, wow. That's cool. That's great that you got the care you needed. And did your shooting improve after he took care of you?
It did, yeah. I was amazed at how quickly, with the work of his hands and doing some manipulation to my neck, that I was pretty much back pain-free and rehabbed and went back and have never had another issue since. So,
oh, wow.
Healthcare was certainly something, the difference he made in my life at the time. Basketball was pretty important to a high school kid.
Sure.
I see, as I worked in rehab, the positive difference we could make in the lives of our patients and their families, and something it was a calling to do, and I love every minute of my work in rural healthcare. Yeah,
that's great. So why the focus? You sound very passionate about rural health. So what is it about rural health that gets you going?
You know, I had that interest in high school, but as I was going through college, we were required to pick a rural hospital experience as an internship in physical therapy, and I picked Ely, Minnesota, which is about an hour and a half kind of north of Two Harbors, and I was there a couple of days, and the hospital administrator walked down the hall, and people knew him by name, and he was interacting with patients and staff, and I thought, this looks pretty interesting. And as I worked in that, you start to build those relationships across the community, and I was out doing some public work as a PT during that internship, and thought you could really see the difference that you were making. And I knew right then that I would spend the next number of years of my career in rural healthcare, either in a rehab setting or working up into management further. And that was always my goal dating back to my college days. And just fortunately, that has all worked out the way that I wanted. And I'm enjoying my role now.
Yeah, it's interesting how life's journey shapes us into what we are and what our interests are. So it sounds like you've had an interesting journey. And thank you for your service.
It's been a lot of fun.
The name of this program is Rural Health Leadership Radio, and I emphasize leadership. What's your definition of leadership, Greg?
So leadership is something I also have a passion for. I take the privilege of leading our Lakeview team very seriously, and I really see my role as someone that comes in and communicates my vision, helps to set the direction of the organization, and really then, most importantly, supporting our leadership team and all of our employees to do the great work that they're doing. So in a way, using a sports metaphor, I kind of feel like days I'm a coach where you're there providing mentoring and feedback and support and helping people solve problems so that they can provide excellent patient care. And so I very much have an open door policy where I'm open to learning and feedback and suggestions, and I really see us all working together for a common purpose.
Well, thank you for sharing that definition with us. Can you give us an overview of Lakeview Hospital and the community that you serve?
Sure. So Lakeview Hospital, like I mentioned, is a 25-bed critical access hospital. We're the only hospital in Lake County, Minnesota. And our primary community that we serve is Two Harbors, with a population of about 3,600. The next largest city is Silver Bay, about 30 miles up the north shore on Lake Superior, and that has a population of about 1,800 people. So our service area covers the majority of Lake County, and we serve about 10,500 people. We've started expanding a little bit into Cook County and St. Louis County as well, with patients choosing us as a destination for healthcare, and we're really happy that they do that.
I'm guessing that you had kind of a brutal winter up there this year.
Yes, we had a tough winter. We've actually been spoiled the last couple of years. We've had pretty mild winters, not real cold, not a lot of snow, but this was a real winter that I remember as a kid growing up here. It was tough. It was long, and these 75 sunny days are welcome to everyone.
Yeah, no kidding. Yeah, it seems like the more snow and more cold than normal, but I'm glad you survived through that. But I'm sure that presented some challenges for you and the opportunity to be innovative. And I know that being innovative is important to you. Can you talk about the importance of innovation in rural health?
Yeah, innovation is something we talk about as a leadership team every week, and we do employee forums here at Lakeview where I give 3 different presentations on a monthly basis to our entire Lakeview team, and we talk about the importance of innovation and being flexible and agile as we address some of the challenges and concerns that are facing rural health care. I think it's, as with any organization or any individual, it's always difficult to embrace change, and we're comfortable doing what we've always done. But I think especially in rural healthcare, we have to be open to innovation, and we have to be looking at ways to improve and drive change and bring more value to our patients. And again, kind of letting go of the old way of doing things and embracing the new industry that's coming at us.
Yeah, that's definitely one of those things that's easier said than done, that's for sure. Can you give us some examples of what you and your team have done that's been innovative?
Sure. One thing that we did about a year ago is we knew that we had to change the way that we covered our inpatient unit at Lakeview. Our physicians at the time were covering call 24/7. They were covering our local skilled nursing facility. They had their clinic practice. They were covering the hospital. And what we found is those physicians had spent their entire careers doing this. But as we were trying to recruit new physicians to our practice and retain the younger physicians who we had hired, we knew that we had to change. They were at this stage of starting families. The 24/7 was seen as somewhat of a burden to them, coming out of medical school and trying to have a more work-life balance. So what we did is we spent many, many months evaluating options, looking at different strategies, and we actually changed our inpatient coverage model to take our employed physicians off of call. And what this did is it allows us to retain 2 high-quality physicians who were newer to the practice. And then pretty quickly after, we recruited 2 more family practice physicians that are joining our clinic later this summer and fall. And that was a big change for all of us on the hospital side, the clinic side, for all of our patients as well. So that was one. The other one that I would share is we were experiencing a lot of challenges with patients in mental health crisis coming into our clinic, into our emergency room, into our hospital, just like many other communities across the country. So we, a couple of years ago, started having conversations with our outpatient behavioral health clinic in town and try to build that partnership. And so we actually worked out a deal where they co-located on our Lakeview campus here in Two Harbors, and they run their entire operation on the north side of our building. But they were able to support, and we were able to collaborate on high-quality care in our ER, in our clinic, and having lunch and learns with the psychiatrist, and really developing more integrated model of care. And again, very different, very innovative for our community, but one that has worked out really, really well.
Yeah, collaboration is huge, and sometimes it's collaborating with somebody else that you wouldn't normally think of collaborating with, but it takes a lot of courage to do that at times. So can you talk about the importance of that and forming partnerships like that?
Yeah, one of the things when I started this role back in 2014, it felt to me, and I'd been here before as a director, but it felt to me like we were a little bit of a silo in our community. As we provided really good care in our hospital and clinic, but we didn't always reach out and work with our other partners. So one of the things we did early on was reached out to local law enforcement, including city police, the county sheriff, our local EMS team, and really sat down and said, how do we tackle some of these issues together, specifically patients in mental health crisis, patients that had violent tendencies that would end up in our ER, patients that had chemical dependency issues that were being brought into ER. And there was always this conflict between the healthcare system and the law enforcement system and whose responsibility it was to care for these patients or keep them overnight. And so we said, we really need to serve our community better, and we need to do so by collaborating. And so we met every month and kind of worked through challenges. We established communication channels. We established goals. We had processes in place if things didn't go well. And so that partnership has been very, very strong over the last 5 years. And we really are able to handle some very complex situations without conflict, and most importantly, doing what's best for our patients and their families. We've built partnerships with the local school district to help support educational classes that we can get students interested in the healthcare profession, and then hopefully down the road we hire them as future physicians and nurses and physical therapists and nutrition staff and all of that.
Very interesting. That's some interesting things that you're doing, both innovative, collaborative, and in partnership with not necessarily the norm for a partnering organization. So thank you for sharing that with us, Greg. Right now, we're going to take a short break. Then we'll be right back to continue our conversation with today's guest, Greg Ruberg, President and CEO of Lakeview Hospital. Greg was just talking about the value of partnering. Too often, we try to go it alone, working in isolation, and that's why it's so important to develop strategic partnerships with other individuals and other organizations. And that's why I would like to tell you how you can develop a strategic partnership with me. When I go to rural health conferences around the country, whether I'm speaking or just attending, people who know me through this podcast often ask me, Bill, what is it that you do? How do you make money? And those are some great questions, because Rural Health Leadership Radio is an altruistic endeavor for me. The Rural Health Leadership Radio organization is a 501c3 nonprofit whose mission is to improve the world by engaging rural health leaders in conversations, learning, and research. The Rural Health Leadership Radio podcast is a big part of achieving that mission. Bill Oxier, Healthcare Executive Coaching, is where I spend the bulk of my time and energy, and yes, that's how I make money. We continuously hear about rural hospital closures and how many rural hospitals are at risk of closing, and it's definitely a major concern. As someone who grew up in a rural area, I get it. And I also understand the difference that effective leadership can make. One of the favorite services that I offer is team coaching. I love working with the leadership team, assisting them in becoming more engaged leaders. And guess what? When leaders become more engaged, so do the employees. And when employees become more engaged, the benefits are multifaceted. There's an improvement in quality of care. There's a reduction in costs. Morale of the employees goes up and more. And when I take on a team coaching gig, it's not like the leadership team was unengaged before we started, but it definitely kicks it up a notch or two. No matter how effective you or your leadership team may be currently, you can always improve. And the best part of all, if after going through my coaching process, if you don't improve, you don't owe me anything. That's right. No growth, no fee. If you think you might be interested in working with me, it's easy. We can schedule a discovery session either on the phone or in person to see if my services would be a good fit for you or your organization, to see if there's an opportunity to deliver value to you and your community. So if you're interested, just send me an email to bill@billoxier.com. That's BILL@BILLAUXIER.com, and we'll set up that discovery session. Don't wait. Email me today. We're having a very interesting conversation today with our guest, Greg Ruberg. Greg is the president and CEO of Lakeview Hospital in Two Harbors, Minnesota. Right before the break, he was talking about the importance of innovation and forming partnerships in the community. You know, when we spoke previously, Greg, you were talking about the importance of culture. Can you talk about that?
Yes. One thing that we've been very focused on at Lakeview over the past number of years is building a really strong organizational culture that's all-inclusive and respectful and professional. Again, I spend a lot of time talking about culture with our team, reading about culture, studying it, and really practicing trying to improve it. And I strongly believe that we have to take care of our employees in our organization before they will ever take good care of our patients. So we spend a lot of time and resources developing staff, coaching, mentoring, providing feedback, and just plain supporting them. And what we've seen as a return is our team here at Lakeview takes absolutely wonderful care of our patients. I mean, every patient's treated as an individual. They're treated respectfully, professionally, with high-quality care. And we've seen that come back on our patient experience surveys. And again, we need to invest in them before they can invest in our patients. And so it's something I'm really proud of, and I've been fortunate to have that role of a CEO to support them in this work.
Yeah, well, you're preaching to the choir on that one, Greg. I love that because too many times, and I get it, you know, the focus is on the patients, and you always have to be focused on the patients, but you have to focus on the employees because, like you said, if they're not being well taken care of, it's more difficult for them to take care of the patient. So thank you for sharing that with us.
Yeah.
You know, what specifically is your organization doing to prepare for the future of rural health during the time of healthcare reform? We're not exactly sure what's really going to be coming out of D.C. or anything like that. What are you guys doing?
Yeah, we have a lot of discussions on this topic and a lot of discussions on strategy and how we need to position ourselves. And, you know, it goes back to a concept I learned about last year. We had a national consultant talking about preparing for working well in the now, preparing for the near, and also preparing for the far. And so we talk about that a lot. And right now we're undergoing a building project. We're going to combine our hospital and clinic into one building. Right now they're separated by a parking lot. And what we're doing is we're creating this new connecting piece of the building, but again, really focusing on outpatient service delivery from a strong primary care clinic to a specialty clinic, infusion therapy, surgery and procedures. Again, really going all in on our future, thinking it was going to be focused on outpatient care, just like many hospitals across the country are doing. But at the same time as we're doing all of that, we want to provide really high-quality inpatient care and strong emergency room services, and so that we can provide that comprehensive care to our community. I think the other piece of that we spend a lot of time on, again, is just learning what's happening out across the state, across the Midwest, and across the country, and trying to learn from others, be open to things that are coming at us. You know, I think about all the disruption in healthcare that's facing us, and we need to be on the forefront of that, trying to either embrace it or figuring it out on our own. So lots of discussion and strategic planning and brainstorming, and again, trying to predict how things are going to fall in the future.
Well, that's interesting that you're doing that. It'd be interesting to sit in on some of those meetings, I'm sure. You know, it sounds like you're really preparing for the future from a policy point of view, but also, you know, we all know that there's going to be disruption, and that's going to have an impact on the healthcare industry. So what are you and your team doing to prepare for that unexpected disruption? Well,
we're trying to really listen to our patients. We're asking our patients, what do they want? What services do they want in the community? How can we provide those more cost effectively, more efficiently? And we're trying to build programs that fit that. I think we're also looking at things like, you know, telehealth and other technologies that can help enhance the care that we deliver. And again, it comes back to being really willing to take some risks, to put ourselves out there and try to serve our patients better versus holding on to our legacy systems that we're all comfortable with. And so I think we I think it's a super exciting time in healthcare to be a leader, to be a provider, to be an employee. We're really writing the future of our industry. And, we know the current industry is not sustainable the way it's going. And so, I think we get to be the authors of what the future could look like. And so we spend a lot of time thinking about that and, again, preparing for that.
Well, that's why I like to talk to CEOs like you, Greg, because a lot of people like the status quo. We all like the status quo to a degree, but to have the opportunity, like you said, to be innovative and to prepare for things that we don't have any idea what's coming down the pike, but we know that we're ready for it, that's kind of cool. So thank you for sharing that information with us. Greg, you've seen a thing or two in the time you've been in healthcare, in rural healthcare in particular, or whether it was as a physical therapist or as a CEO. What scares you the most about the future of rural health?
Well, one of the things I'm really concerned about is the financial pressures that are impacting rural healthcare facilities, hospitals, and clinics. And I think that has big consequences on those communities where those hospitals are located. That's very important access to care, emergency care, inpatient care, outpatient care, but also they're large employers in those communities. And I think the financial pressures from, workforce challenges and declining reimbursement and other regulation is really having an impact. And so I see that as something I'm nervous about in the future across our country. I also get concerned about when I speak to rural healthcare leaders or part members of leadership teams that are really not embracing the changes that are coming. They're really holding on to that legacy system. And I really think as an industry, we're going to be in trouble unless we, as an industry, get out there and try to solve some of these problems ourselves versus having that done to us externally. So again, we should be embracing innovation. We should be working with partners, looking at opportunity versus saying, we're going to try to survive this and we'll be fine. I think we need to shift from what we think is best for our organizations and staff to what's best for patients and families. We need to really be clear about that and be deliberate and work hard to get there.
Yeah, the days of white knuckling it are over, aren't they?
I think so.
Yeah. Well, that's what scares you. What excites you the most about the future of rural health?
Well, again, I think it's an excellent time to be in healthcare as a leader, as a provider. I think if you enjoy challenges and problem solving and lifelong learning and tackling challenges, there's no better industry to be in right now. And that really excites me. I think every day I come to work, I think we have the opportunity to make a difference in our community. And it could be doing something that we do right now really well. It could be bringing a new service into town. For example, we just hired a behavioral health nurse practitioner, and we're going to bring her on board August 1st, and we're going to integrate behavioral health into our primary care clinic. So we're going to, reach out and support our community. We're going to partner with an agency in Duluth to support them as well. So again, these are things that I think we've got opportunities to really go out and try to accomplish and be successful with. And there's no time like now to try some of this work.
Absolutely. And with a guy like you at the helm, I have no doubt that your hospital will be successful at that. The time has flown by. In the short time we've been talking here, we've covered a lot of ground. If our listeners only take one thing away from our conversation today, what should that be?
This is an easy one for me to answer. I would say people are our biggest assets. I feel strongly that we must invest in the growth and development of our employees, support our team across the hospital and the clinic, really invest in them and create a culture where they want to work here and they want to serve patients in our community. And secondly, I think our patients and their families are also important. That we can never lose focus on why we're here. I always use the example when we face a tough decision, it always comes down to what's best for the patient. And if we can do that, that's the route that we go. So again, I think if we keep our employee team in focus and our patients and their family in our focus, we'll be just fine and come through all of this healthcare reform successfully in the end.
Greg Ruberg, President and CEO of Lakeview Hospital in Two Harbors, Minnesota. Thank you again for joining us today.
You're welcome. Thank you for having me.
I really appreciate you sharing your expertise, your firsthand knowledge, and your years of service working in rural health and healthcare in general. And I want to thank all of you out there for listening today. If you enjoyed today's episode, please go to iTunes, Google Play, Stitcher, whatever your favorite podcast app might be, and subscribe to Rural Health Leadership Radio. And while you're on Facebook today, check out our Facebook page. Yes, Rural Health Leadership Radio has a Facebook page, and we love likes. Until next week, let's keep working to improve rural health, one conversation at a time.
If you would like to connect with today's guest, please send an email with your contact information to bill@billoxier.com. If you would like to be a guest or suggest someone else as a guest, have a question you would like to ask, or simply want to contact Rural Health Leadership Radio, please use that same email address, bill@billauxier.com. That's BILL@BILLAUXIER.com. You can also visit our website at www.rhlradio.com.
And we'd ask that you please support our sponsor, the Dynamic Leadership Academy for Rural Health. The Dynamic Leadership Academy for Rural Health's mission is to improve rural health, one leader at a time.